am Dr. Venugopal Reddy, Senior Consultant ENT Surgeon, Sunshine Hospital, Signal. Today I want to discuss about the commonest problem nowadays is sinus problems, both in adults and also young children. So I want to explain about this sinus problems in why this problem is very common and how to treat it, either medication or surgery, and what are the complications. Actually, why we should treat a disease to prevent a complication. So this is nowadays, unlike olden days, those days we have tonsils and adenoids problem very common. Nowadays we have sinus problems are very common because mainly the issue is pollution, air pollution. Respiratory allergies are common nowadays because of the pollution and smoke. Smoke is the main culprit. Vehicular pollution is the main culprit. Industrial pollution is the second one. So these things we cannot prevent. We have to work, we have to do our things, going to school, or children or adults going to the office. So these things are avoidable. Pollution we cannot avoid. We can reduce pollution by different measures. That is a social problem. Whatever we are now going for duties or whatever, regular life is going in that polluted area only. So how to cope up with the pollution, that is a different one. But how to early stage prevent sinus problems, or once sinus problem is established, what remedies we have now available. So actually, before going into sinus problem, I will explain what is sinus. Sinuses are air cavities in the skull. To lighten our skull bones, air cavities are created by nature. So these air cavities are different: maxillary sinuses, ethmoidal sinuses, and sphenoid sinuses. So there are many air cavities in the skull. All these sinuses are connected with the nose. That is the issue. These air cavities, they secrete a regular mucoid discharge that goes into the nose. It goes postnasally to the throat, and we will swallow it without our knowledge. Normally, because lubrication is necessary for the sinuses. About 250 ml of secretions comes from all the sinuses daily, and everybody we swallow without our noticeable thing. When it is excess only, we will notice it. So these are natural cavities, and they are connected with the nose. Because of the pollution, we get allergies and we will get problems. So in children is a different problem. Young children, why they get sinus problem? This is because of tonsils and adenoids, which is the commonest problem in children in the age group of 5 to 10. Repeatedly they got cold, respiratory infection because immunity is low for them. School going children, other children get affected. So these people also get affected frequently. And subclinical treatment, that means we are giving antibiotics which are not maybe adequate, either because of a doctor's mistake or because the child don't take continuously for 3 to 5 days. So minimum 5 days we should take antibiotic once it started. But usually after 24 hours, if they become better, we avoid antibiotics. And this is the common reason for resistance for antibiotics. Also, infection may remain subclinically in the tonsils and adenoids. That is the secondary thing. So if he gets a respiratory infections frequently, tonsils and adenoids should be removed to prevent sinus infections. Anyhow, if they are not treated properly, the children, when they come 10 to 12 years, sinus infection may start in children also. Nowadays we are seeing more children affected by sinus infections because they are not treated properly in the early age. That is one thing. But in adults, most commonly because of the respiratory allergy, that is because of the pollution is the main culprit. Other thing is maybe smokers, asthmatic patients, and other things like immunity deficiencies. These things also will affect for common sinus problem.